Hello, class. My name is Charles Blanchard, and today we're going to discuss the benefits and weaknesses of electronic health records. As I'm sure at this point in the semester, we're all pretty versed and familiar to the electronic health record, but I just wanted to help try to expand upon the knowledge that we already have on the benefits and weaknesses of EHR, so that way we can take that information into our future role as a professional and help transform things for the better good. So I want to go ahead and move into the objectives of today, which is to have a better understanding of the difference between EHR and EMR. Of course, understanding the benefits of why we need them, and then the weaknesses that are creating the delay in the utilization of EHR, and how we can favorably tip the balance to be more beneficial for healthcare and increase the utilization in the future, which we'll actually wrap up today with discussing what the future of HR is proposed to look like. So let's go ahead and start with the definition of HR and understanding how it's a little bit different than what is EMR. A lot of times it can be used interchangeably, but whenever it comes down to technicalities, there is a difference. So EMR is actually something that is a digital version of a paper chart, and it contains all the patient's medical records or medical history from one practice. And it's mostly used by providers and for diagnosis and treatment of specific conditions. And the EHR is going to take that and actually expand upon to have it is going to encompass the other records that may come from a specialist or from laboratories or radiology results, and it provides a more broad picture of what's going on in the patient's treatment across time. So, as we now have the understanding of the difference between EHR and EMR, I want to go ahead and move into the benefits of EHR. I previously did a presentation earlier this semester that actually opened my eyes to the knowledge of paper records were still pretty heavily utilized even as early back as 2005. So to me, I found that really astonishing to know that here we are just a little over a decade later, and EHR is significantly increased in utilization compared to back in 2005, and I can't even think about what it would be like being a HIM professional back then and how important their role was in kind of bridging those gaps. So thinking about the potential health benefits of EHR, it really helps to coordinate care between various facilities or providers, and it actually helps measure quality as you're able to better capture how things are being done across time, whereas a lot of times it can be fragmented before whenever it was on patient paper records, and of course it helps in the reduction of medical errors as it provides a foundation for consistent communication between different providers and being able to understand progression of treatment. So looking into the potential efficiency savings, having EHR has been shown to help in the reduction of hospital stays as far as the length of the stays. It helps save in the administrative time of being able to look up records and pull different data and being able to assist the physician in creating the best treatment for the patient's condition. And also drug usage in hospitals and drug and radiology use in outpatient setting, as prior article that I had read that also showed that this can account for over $77 billion a year. So if we're able to take those funds and reallocate them to a different area, then we'd be able to really help continue to transform what we define as healthcare today. So continuing with the benefits of EHR, I wanted to go ahead and discuss health information technology for short-term preventive, as I feel like that's been very prominent in the past decade. That's kind of what we're capturing in today's presentation and the actual rollout of ACA. There's been a lot of talk about how preventive is important and how much can be saved in terms of the years of life that can be gained. So EHR really helps with that push, as it helps provide physician reminders that are applicable to age, sex, or family history, to help encourage patients to get those mammograms done or get those cervical cancer screenings done. Just a glimpse of how many years of life can be gained. I had an article that I read as well that showed that 13,000 years of life can be gained just solely from cervical cancer screening. So just thinking about how much of that is a drop in the bucket compared to all the other type of screenings that are important at different age levels, and how many years could be gained by catching things soon enough and actually increasing the utilization for patients with the reminders from physicians. That kind of segues into the potential safety benefits of EHR, as it helps provide physicians reminders and alerts of different drug interactions. And a lot of times drug interactions are things that could be prevented by having those reminders or alerts, and essentially saving both the patient harm and costs, as well as the provider, avoiding any potential malpractices, and also reducing actual costs for them as well. And ultimately, the most important thing is the patient's quality care. So that also helps with that and avoiding any unnecessary interactions and procedures. So taking that into account, let's go ahead and move on to the other side and think about the weaknesses of EHR. As I'm sure we've also become familiar with, a lot of EHR issues, but the largest barrier that occurs with the implementation of EHR is actually the cost and the uncertainty of the payoff of having EHR implemented. A lot of hesitancy is that it does have a large upfront cost, and it can at times cause workflow disruption. Just like any program or software that you roll out, there's kinks that happen. It doesn't roll out as smoothly as possible. The unfamiliarity of it and improper training are things that all lead to the workflow disruption. So it's very important to have the right team in place for the implementation. There's also not really a set standardization for EHR. There's a lot of vendors that are available that provide software. So if you think about the idea of having 25, if not more, and this is just picking a random number, of different vendors that could actually be providing EHR options, rather than having a set core or standard of EHR software, then interoperability and ultimately becomes very challenging, as not all the software interacts with one another. There might be at different levels of interoperability and different functions that it can do. So that's definitely a weakness of EHR, having a lack of standardization, the costs, disruption, and the workflow. Also privacy concerns, thinking about more ways in which a patient's records can be accessed. It's more than before with paper records. That's definitely a weakness. We have to make sure to have proper safeguards to the patient's records and making sure that they're only being used for the proper or the need for that given healthcare professional that's accessing the information. More weaknesses of the EHR is usability. It's actually not always physician friendly, as it can be a major time sink, and physician isn't necessarily to do that. It's kind of something that you would presume to be more of an administrative thing. As I mentioned just a moment ago, there's issues with lack of training, having too many vendors, and then thinking about the cost of hardware or even system maintenance. Another presentation that I did earlier this semester was actually focusing on the implementation of EHR. So there's the upfront costs that can be pretty significant, and then the to maintain software updates and different functionality. And these weaknesses combined can really provide or create an aversion or hesitance or resistance to change across the entire office or facility, and that can still create the implementation of EHR to be rather unsuccessful. So, taking that into account, I wanted to go ahead and move into how can we really tip the balance to be more favorable in the implementation and the actual utilization and success of having EHR. While thinking about today, we have come a long way. There's still a lot more that we can do and a lot that we can achieve by having more efficient and more interoperable EHR software in place. So it is going to require substantial investments for that particular organization or provider to have the right staff and software and training to really make sure that it does go as smoothly as possible. The provider or facility is going to have to be open to that change. It's really going to have to be spearheading and setting the example, really pushing, being open to the feedback on a end user level, on all levels essentially. So that way, any issues can be addressed as quickly as possible, and making sure that it has as minimal disruption as possible. It also is going to be important that it has a certain level of system interoperability, so that way it can communicate and pull data from other providers and specialists. Thinking about increased utilization, which is the ideal goal for EHR, it's going to be important to have a infrastructure that can support the future demand. And thinking about the future demands of EHR, it's also important to have a very robust information exchange network in place, so that way it can facilitate that type of exchange of information. And I am a big advocate that I think that it's going to be important to have some form of government policy, essentially helping with incentivizing providers or facilities to take that leap and implement EHR, helping with the upfront costs, whether it be something that is a tax break for that given year that they roll it out, or a payback system across the years, kind of a loan in advance. That becomes a whole different political issue as far as how that should be addressed. But essentially, I do think that the government should provide some type of incentive to help move things forward with the implementation of UHR across the nation, so that way we can move forward through increased interoperability and having a certain level of standard and core structure to be able to streamline communication between different providers. And now we're going to go ahead and move on into the future of EHR. So I found another article that actually states that EHRs need to facilitate practice workflows. They need to move away from documentation time sinks and embrace technologies that allow documentation to be finished by the time the clinician leaves the exam room. This also addresses the issue of the weaknesses previously discussed. Also the idea of EHR being enterprise charts and global patient data repository. And these two terms essentially are the vision that EHR will become something that is a more compiled capture of the patient's treatment across times, across various providers, having easier access, and actually really being able to use that data in a manner that actually helps the provider anticipate and really provide the highest quality of care for the patient. And I believe that with this, it's even more so important as patients actually continue to shop around, become more educated consumers, and really get the care that they need. They're going to move around and see different providers outside of different clinics. And it's important to have that interoperability between not only just larger healthcare clinics, but across the board, and having that standardization. So these two terms actually help to encompass that vision, and you can learn more under the Rowley reference. And I